and get started, I want to welcome everyone to our webcast this afternoon featuring Brookings Health Systems and their perspective on Meditech dictionary management and synchronization with a highlight of the Summit InSync technology. Before I turn it over to our speaker, Ryan, I wanted to just do a little bit of housekeeping, if you will, let you know that we'll be getting you a copy of the PowerPoint either today or by tomorrow. We also have a Q&A session set up for the close of the presentation, so if you do can rather stay on with us, certainly want to open it up for questions. If you do think of things along the way, there is a question panel area in the GoToMeeting screen, so simply type in your question and we'll certainly read that off for you. So without further ado, again, I want to introduce and welcome Ryan Woolner today, Senior Information Systems Analyst at Brookings Health Systems. Ryan's going to be taking us through Brookings Health Systems experience with dictionary management and synchronization, and of course his experience with the Summit InSync technology tool as well. I also have joining us Brian Rogers, who is our product manager of the Summit InSync technology, and he'll be going through a very short demonstration at the close of the presentation just to kind of show you how the technology works so you can see it live in action. So without further ado, I'm going to turn it over to Ryan, who will be bringing us slides here.
Thanks, Tara. As Tara said, I'm Ryan Woolner, Senior Information Systems Analyst here at the Brookings Health System in Brookings, South Dakota. As you can see on the slide, we are a nonprofit, city-owned health system. We have inpatient beds of 49 and also a nursing home, 79-bed nursing home. And Tara, could you go back to that previous slide for me? Thanks. We also have a couple of outreach clinics, rural health clinics, one in Arlington, South Dakota, and White, South Dakota. We currently employ about 435 staff. The IT department is 6. We have 3 systems analysts, our help desk technician, grant manager, and our IT director, which oversees the department. We are currently using Meditech version 5.6.4, which we upgraded to just over a year ago, back in June of 2011. And basically what I wanted to talk today was sort of what prompted us to pursue a synchronization software and also how they've been helping us ever since we went through our upgrade. So what initially prompted our need for synchronization software was actually following our upgrade last June from 5.5.4 to 5.6.4. We had some data, quite a bit of data, sitting in our MIS dictionaries that was still in our old test string, our version 5.5 test string. And we needed to get that information over to our 5.6.4 test string. And Meditech's response when we asked them if they could facilitate this for us was, well, you'll have to type everything over again. And the clinical analyst that had spent the time inputting this information, getting it ready for live, had spent, I would say, a good 40+ hours of her time getting this prepared and was absolutely not interested in redoing that amount of work. And so that actually prompted us to try to find a solution that we knew this wasn't the last time that this was going to happen. This is a special circumstance because of the upgrade, but we had just general issues with trying to get information synchronized from one ring to the other. And that prompted us to pursue the synchronization solution, which we found here with Summit InSync. Initially, we were provided Summit Healthcare's name from another health system we partner up with a lot, which is Avera here in South Dakota. While they are actually not Summit InSync users, they have implemented many other technologies of theirs, including the HL7 engine.
Interface engine, yeah.
And they spoke very, very, very highly of Summit Healthcare. And so we evaluated the product. We were very pleased with the demonstration that we saw, and there was no question in our minds that this this was the product that we wanted to pursue. As you can see on the slide, some of the benefits of InSync is it lets you extract the data from both test and live rings and lets you compare similarities and differences between the two rings. It flags things for you, so it makes it, the color-coded analysis there in bullet 2 makes it very easy to see what records are identical versus what have differences. And the main thing that I wanted to speak on Summit's behalf today is dictionaries that we are primarily using the Summit InSync and the scripting toolkit for. As you can see there, we have a number of clinical dictionaries. The biggest ones we're utilizing right now is the Pharmacy Drug Dictionary and several lab dictionaries. The Pharmacy Drug Dictionary need came out, again, from the request by Meditech that everything needs to be double entered. You put it into the test dictionary, you get it the way you want it to be, and then you type it into the live dictionary. And many of our analysts just simply do not have the time to do this. And so we were able to extract the drugs that our pharmacy analyst is entering into the Pharmacy Drug Dictionary and make sure that that data gets synchronized between the two rings. In terms of financials, the biggest drive there was actually the two rural health clinics in Arlington and White. The one in Arlington opened first, and then we were getting ready to open the clinic in White, South Dakota. And we realized that those dictionaries for bar were going to be virtually identical with very small exceptions. For example, the charge procedures we're going to have the exact same mnemonics, and virtually every other field is the same, with just a slight difference, which would be the GL corporation associated with it. And rather than having a business office staff member sit and hand key all of these entries, virtually copying what was already set up for our Arlington clinic, for our White clinic, the Summit Scripting Toolkit was able to facilitate that using just a very simple find and replace. It said, if you see the corporation that is this, just replace it with White's corporation, and saved many, many hours of manual entry with that part. And then the MIS dictionary, as you see at the bottom, those were primarily the dictionaries that our clinical analysts had put into our old test string that Meditech had told her that she would have to rekey into our new 564 test string before they would provide her any. And it's just been a fantastic experience with getting this information moved from one ring to another. And then Tara helped put together some metrics that we've seen. We don't have any hard numbers yet, but from just sort of informally surveying staff members in the other departments in the hospital, we found that they've been able to save about 1 to 4 hours of work for every single time that we synchronize the dictionary from one ring to another. Previously, what they were doing, as many of you probably already know, is they would pull up Meditech Test, they would pull up Meditech Live, and they would just simply flip back and forth, copy and paste, or hand typing. It was very time-consuming, very subject to human error, and it just was not worth the time that that person was spending on typing something that they had already done. The second bullet about increased efficiencies feeds directly into the third bullet regarding the NPR reports. Previously, if we did need to compare dictionaries, we had one of two options. It was either pull up the two screens and look at it by hand, or generate NPR reports that could potentially compare, or sometimes couldn't, and ended up doing a manual compare. But even so, generating the NPR reports was extremely time-consuming and far more time-consuming than it is to utilize InSync and the Summit Script Toolkit, which will actually not only compare the dictionaries for you within, depending on the size of the dictionary, it can compare two dictionaries in two separate rings in a matter of minutes. And then even writing the script on top of that is far more efficient than writing custom NPR reports.
Okay. I think that was where I was going to take over and just briefly talk a little bit about some additional considerations with dictionary management, and before I turn it over to Brian Rogers. Thank you, Ryan, so much for your perspective. And as mentioned to some perhaps late joiners here, Ryan will be staying on. We're going to do probably about a 15-minute demo, and then we'll open it up for Q&A. And I certainly will get a copy of the PowerPoint as well to everyone. Ryan, do you feel this is okay for me to transfer over to this slide now?
Absolutely. Thanks, Tara.
Okay. Thank you. And I apologize, folks, there seems to be a timer built into the slides, so you're probably wondering why the slides were flickering a bit, but that's what that was. So hopefully I can get that addressed before I send the PowerPoint over to you. But again, just moving along here as it relates to just some additional considerations. I think Ryan talked a lot about what some of the driving factors were there at Brookings Health System, but these are some other driving factors that we've found from our clients that are currently leveraging the InSync technology. So I just wanted to simply point as some of the organizations on the line might go into these different groupings or different buckets, if you will. So I think we hit along the general IT maintenance, as we just heard, just the ability to have change control policies in place, be able to accurately test DTS fixes, whether minor or major. So that kind of falls into that general IT maintenance of just keeping your live and test to live, which way you want to describe it, in sync, if you will. Another thing to think about that is often goes unnoticed is around mass dictionary edits. So sometimes you might have a dictionary like a charge master or a pharmacy drug dictionary that may have 1,500 entries, and there just has to simply be a field that changes from yes to no for, say, 1/3 of the dictionary. So the InSync technology will allow you to extract that data, do that quick kind of change, if you will, in the analysis piece, and then the automation component, the scripting component, will go in and change that field from yes to no, rather than having an end user go in and manually log into all of those entries. So that perhaps might be another example of how you can leverage the technology. For some of our larger organizations, you may fall into bullet number 3, and that's where we find like multi-facilities can certainly benefit from technology like this. One organization that comes to mind is Steward Healthcare here in New England. They were a 6-facility organization, and they were looking to streamline policies in their pharmacy drug dictionaries, if you will, across all 6 facilities because they just had shared staff. So they wanted to make sure that, the drug dictionary as it reads for facility 1 with the same types of route of administration and warnings and indicators and whatnot looked the same across all 6 facilities. So that implementation of policies and shared dictionaries can certainly come into play if you're 2 facilities up to, say 6 facilities. Moving along, advanced clinical modules, sometimes folks will overlook. If you're going through, say, bringing on computerized physician order entry or EMR, BMV, the nurses will be scanning medications, or even bringing on ORM at a later time, operating room management. A lot of those advanced clinical modules touch dictionaries that may have been built years and years ago. So again, just keeping on that clinical example, the pharmacy drug dictionary may have been built, 4 years ago when you weren't running these advanced clinicals, and now you're having to go back and touch the NDC codes, touch particular fields that are going to prompt the nurse when they're scanning the medication. So you have to kind of think about how am I going to have to go through and evaluate and make changes to those dictionaries. And you're not only going to have to be, looking at the discrepancies between test and live, but also between, what was there before and what needs to be there now. So another example to think about. Hand in hand with that is realistic training environments. So oftentimes, again, as folks bring on a new training group of nurses or bring on these clinical modules, for example, they're now in a situation where they have to create a realistic training environment. So you're looking to train, say, 100 nurses. You want to make sure when they're going into that testing or training ring that they're creating a realistic environment. So when they scan that medication, they have the appropriate warnings, the appropriate allergies and interactions are popping up for them. So the ability to create that realistic training environment just goes back to the importance of keeping tests alive in sync. And just the last 2 bullet points here, migrating to Meditech 6.0, for example, has come up oftentimes over the last couple of years as organizations are looking to move to the new platform, or really any major upgrade, as Ryan mentioned, when they went from 5.5 to 5.6. It's kind of just thinking about, what is in your existing world, what needs to go into your new world. and how you can assess those differences. And then just lastly, conversion of systems. You know, again, I hope that most organizations on the line aren't looking to go through a major HIS because of conversion, because of course that can be taking. But even oftentimes we're finding that you may have been using a standalone ED system for years, and now you're looking to move to the Meditech ED system. So just the ability to kind of, again, assess what your landscape looks like and being able to extract data and compare. And InSync can extract and accept data rather from other systems, for example. So all just kind of advantages and things built right into the technology that I did want to point out. So with that, I'm going to stop talking, and we're going to turn it over to Brian Rogers, who is going to do, as I mentioned, a demonstration of the technology. So I do encourage you folks to stay on. We'll probably go till about 12:40 or so that we can do a Q&A here after the demonstration. So Brian, with that, I'm going to go ahead and make you presenter so we can take a look at the technology.
Okay, thank you, Tara, and thank you, Ryan. Again, Brian Rogers here. I'm a product manager at Summit Healthcare, responsible for the InSync and the scripting tool and also the downtime reporting system. So what I'll do is just give a quick look at the InSync product. We'll look at an example project where we'll extract Meditech data from the MIS room and bed dictionary. So I'm actually on one of our client systems here who lets us do some extractions for these demos. And I've got the project loaded here. So the way InSync works is you'll create a project for each dictionary that you want to analyze and synchronize. So you can do it dictionary by dictionary. It's not a global, live to test type of synchronization. What's going to happen, and if you follow along the left side of the screen, these three panels, those are those three steps. So the top left being extracting the data from Meditech. The middle section is the analysis step where we can apply some filters and mark which records need to be updated. And then the last step, actual update, which is running, as Ryan mentioned, scripts that are built from our scripting toolkit. So we'll go through some of those. The extraction is very easy. It's really just a four-step wizard. So we'll get to go through what that wizard looks like. Step one, we're extracting directly from Meditech. So this is really the true power of the tool. We're querying data directly from your Meditech database. We're putting it into a SQL database. So we're getting it out and putting it in a format where we can do a lot more efficient things with it, like joins and some real true SQL queries, which are much more efficient. You do also have a bullet here, as you can see, to import dictionary data from text files. It's not used very often, but it is an option where if you have some NPR reports or something pulling, or even non-Meditech data that you can put into text files of a certain format, InSync can analyze differences between sets of files. But again, we're going to do a direct extract. That's really where the power is in the tool. Step two is just connectivity. You don't really need to change much here aside from the HDIS. So we're going to pull from live. The second time we go through this wizard, we'll pull from test. You can also compare test to test if you have different rings or training. So you can compare any combination of those HDISs. The schema, by the way, just to quickly mention what the schema is, that's basically how InSync knows what your Meditech installation looks like. So when we generate this schema, which you really only have to do once per Meditech update, InSync will go through your database, your Meditech database, and say, all right, we've got MIS and radiology and lab, and these are all the fields that I find in your Meditech install. So that's kind of the link between our product and Meditech. Okay, the third step is to choose the dictionary. So you can see I've chosen MIS rooms. This list will be much larger than what I have in my demo system and can include any Meditech dictionary in this dropdown. So choose the dictionary, and then we'll show you the tables or segments, as Meditech calls them, that exist in that dictionary. And we do that just so you can uncheck anything that you may know that you don't need or don't care about. So it's an opportunity to reduce the amount of data that we're pulling out. If you don't know what those tables are, you can select them all for the most part. That'll be fine. The last step is the same idea down to the field level, and the reason we show this is for Fields like this last dot update, which is just a timestamp. We want to uncheck that since we wouldn't expect that to really ever be the same between test and live. The other thing we're giving you an opportunity to do here is change the type of data that these fields will be stored as when we put them in our SQL database. Meditech tends to store everything as text in their database. There's a few fields that you can see are a number or a date. Large, they basically store everything as text and they figure it out later. But if we wanted to say, look at the bed count, if we change that to a number, we'll be able to apply some filters later to say things like, just show me rooms with less than 3 beds, or more than 3 beds, or 5 beds, or whatever you want the filter to be. So we can apply some more logical filtering by changing the data type. Okay, that's really it. We can finish the wizard. Again, you would copy that and repeat it for the test side. So you would just run through that wizard 2 times. I'm going to kick off this extraction so we can see what this looks like. So this is actually pulling a fresh set of room and bed data from live and test from this hospital. This is a 6-0 hospital in Colorado. So this will take about a minute. It's not a huge dictionary. It's a good example, I think, because it does have some sort of generations. It's got the rooms, it's got the beds. Inside the beds, there's components and some additional things. So there's a good amount of fields overall, but I think about 250 rooms once it's complete. Yeah. So you start to see this go down the list here. The extractions are very quick. The analysis is even faster since we're just doing some comparisons within our own SQL table. While this is working, some of the other advantages that we can offer for having put this data into your SQL database is that you can keep it around as long as you want, for one. So you always have now this snapshot of this dictionary that we take today that you could always look back to or turn back to if you wanted to reverse any of these decisions. You've got a backup, basically, of this dictionary data. The last 2 steps are actually generating some reports. So we see some PDFs being built at the last step to provide some pie charts and some nice reporting tools. So we can take a look at those in a moment here. Okay, the extraction's done. It's just going to load up the analysis for me, which is that color-coded set of mnemonics with some check marks, and I'll explain what we're looking at here. First of all, let's take a look at the analysis report. This is a great tool, I think, to look at initially when you complete an extraction to sort of see sort of how bad off a dictionary is from a high level. I'll make this a little smaller. Okay, so again, this is our room and bed dictionary. This is real Meditech data. I didn't make any of this up. What we can see here is there's 258 rooms in the hospital. 20 of them are not in sync. Of those 20, 12 exist in live and test but have some field level differences, and there's 8 rooms that exist only in the test system. Pie charts there. We'll then take that down to table by table level, so you can see most of the problems are actually in the bed table by looking at the bar graph, whereas the facilities, bed components, those things aren't too bad off. Okay, so that's a report that can actually be automatically emailed to you when the extraction completes. So you can schedule this part of it maybe on a Friday night when the system is not heavily used or something. You can have one of these extractions kick off, particularly for the larger dictionaries that may take 45 minutes or even a couple hours if they're very large. Let those run overnight, and you can get this PDF in your inbox in the morning. Okay, real quick, what we're looking at with the different colors here. Let's start with this bed 01. So we can see by the check marks that this exists only in the test system. We can see what the data is down at the bottom half of the screen from the test system. Of course, the live side is all blank. Up one to this B337. Things actually look good at the field level here. So we can see between live and test, there actually are no problems at the room level. But what the yellow warning sign means is we have to just dig a little further. So if we expand that out, we can see there's a a number of beds, and it may be very small for you, but there is a red exclamation point over the beds table icon. Sure enough, if I go into the beds, bed 1 looks good, but bed 2 has a problem. And I can see here that it's the housekeeping extension. Doesn't exist in live, and it's 8337 in test. So just to show you can drill down into these, and you can see, if you care, specifically what the problems are for a particular mnemonic. If it's enough for you to know that there's a difference, and whatever that difference is needs to be fixed, that's fine too. We can just update the whole record for you. They'll show you here in a moment. We don't show you any of the groups which would indicate that they're perfectly synchronized. So those other 238 rooms that are perfect, we don't even show them to you here by default. Okay, that's pretty much all the distinctions. There's one here at the bottom called test. The room is actually called test. And just to point out, if we look at the difference here, the active field is no in live. What I want to point out through this is that that's probably intentional. If the room is called test, I imagine it got copied to live and they don't want it there, so they inactivated it. And InSync will ignore this record. By not marking it for update, we'll leave it alone. We don't want to go ahead and activate that room in the live system. So to actually indicate which side is correct and to set up the script to run for step 3, there's this sync direction column. And if you click in here, you can see it start to generate these green arrows. And by doing this manually, obviously it would take a while if I have records, but that lets me pick and choose which rooms should be updated and in which direction the update should flow. Of course, there's a global marking option. So what we can do is take everything maybe from the test system. We want to send it to live, obey the filters that I've set up, and then we can mark all of those records. So all those rooms will be marked for update. One thing I skipped over, I'll just quickly go back on, are the filters. I think that's important once this finishes marking my records. So we have 2 levels of filtering. The primary filters let you say things like, just show me records that exist in live but not test, or test but not live, in the middle of this screen here. Okay, or we can say things like, just show me records that exist in both test and live but have some field level differences. So those are the 3 primary filters that are important. But we can also allow you to create your own secondary filters. And I've got one here that says, just show me rooms where the active field is equal to yes. So if I turn this rule on, basically it's only going to show me things that are active on both sides. That would probably be a more accurate list of rooms that have problems. So you can create this type of filter for any field in any dictionary in Meditech. If you're looking for drugs that are of type vaccine, I think that was actually one of Ryan's examples. That's a great way to be able to just look at that subset of records. Yeah, cancel out of here. Now, I went to run this update script earlier, and I found that Boulder's test system was not working for me. So I think either our password expired or something. So I'm going to run the script locally, so at least we can see what that looks like. Unfortunately, it won't look too much like Meditech. I've got a script here that is doing the same exact thing. We've marked a bunch of records to be scripted. And what this is going to script into in this case, it obviously won't look like Meditech since it's not a Meditech system, but we'll see it log into an application, and I just did this for the demo just so I can show you what the scripting will look like while it's running. You'll see it in this case populating this item maintenance catalog. So the script is actually doing this. It's pulling the data that I've analyzed from InSync. It's going to be either building or updating these records, hopefully in Meditech. And it's also checking for any errors as it does this. So room dictionary is actually a good example. If a bed is occupied within a room, you get a very specific pop-up message from Meditech that says you can't edit these fields because the room is occupied. So that type of exception, we call it, the script is taught to handle and will respond in any way you wish. So typically you would mark that record as having an error and just move on to the next room. We will write a message back to the InSync project. So I'll refresh mine here, and we'll see in the status column on the far right side either something like the word OK or complete or synchronized, or if there was any error or warning, we would see that specific error message listed there on the right side. And there's a PDF report that's generated for those as well, so you can see your update status following the synchronization of this data. Okay, that's basically what I wanted to show today, and I guess I'll turn it back over to Tara.
Okay, thank you, Brian. All right, folks, I just wanted to take this time to open it up for any questions you may have. If you want to, you can simply unmute your phone, or if you want to type in any questions into the question box, I can read those off. And again, any technical questions, Brian can certainly answer. Any process questions, Ryan, of course, is still here as well to answer any of those questions. So if anyone has any questions for the team, we'd be happy to take them. Okay. No problem if you don't have any now. If you do think of any questions, certainly don't hesitate to contact us. As mentioned, I will get a copy of the PowerPoint out to everyone, which will also have not only Summit Healthcare's contact information, but Ryan's contact information as well. But we certainly appreciate you taking the time to join us this afternoon. We hope you found this very useful and a good way to understand kind of what the clients are doing here. So thank you again for your time, and thank you so much, Ryan, for joining us out of your day to kind of give your experience here to the folks that have joined. So I guess with that, I'll go with the line. Again, thanks so much, everyone, and we will be in touch with follow-up PowerPoint shortly. Take care, everyone. Have a great rest of your day. Bye-bye.